Health Talk. And joining me to do the health talk is Dr. Oduanye Badmos Sekinat. She's a consultant family physician and one of the coordinating consultants at the Medical Emergency LASUTH, that's Lagos State University Teaching Hospital, Ikeja. Dr. Sekinat, thank you very much for joining us on VOP 90.3 FM.
It's a pleasure joining you here today.
So you have to speak a little louder.
That's
so
fine.
Okay, so talk to us. What are we talking about today? Go ahead.
All right. Yeah, today we want to have a little talk on Code Red, the golden hour. How exactly, are we supposed to recognize and emergencies, and what actions can we take, when we have emergencies? Very importantly, we need to talk about, common emergencies that can happen at home and what we should do, because we realize that a lot of times what we do in a bit to helping the person eventually ends up worsening the emergency rather than helping the patient. So,
You're talking about some domestic accidents that can...
common medical emergencies that can happen, like, stroke, heart attack.
Okay.
These are things that happen. A lot of times when it happens, people are there. But the question is, what do they do? A lot of times let's start. Emergencies can happen anywhere, and that's why they are called emergencies, right? You don't prepare for them. But it's very important for us to increase our knowledge base in terms of recognizing what these things are when we see it. So, quickly, let's look into a very common one.
You're the experts. I leave the mic to you.
Yes.
Go ahead. We're listening.
A very common one would be stroke, right?
Okay.
You're just talking to someone, just like as both of us are having this conversation, and all of a sudden you notice that the person's speech, starts getting wobbly, or somebody was on the way to the toilet, to the restroom, and all of a sudden the person just drops. The person did not collapse, but it's just that all of a sudden you could notice that the right side of the person's body is not working. A lot of times, yes, people could say maybe a stroke has happened. Commonly, people will say partial stroke. They are looking at it because one side of the patient's body, is not working. That's not partial stroke. A stroke is a stroke. So we have this,
there's nothing like partial stroke.
A stroke is a stroke, really.
Okay.
Because people will come, because one side is affected, it is a stroke. What are some of the things that we see that would make us know that somebody just had a stroke? Or somebody, is going through an episode of stroke? Because sometimes all the symptoms don't come, all at once. So there's this common mnemonic we say FAST, F-A-S-T. You look at the person's face. So you could notice that, at that point you can notice that the person's face is, tilting towards one side. Or the person starts drilling saliva. This is somebody who was just talking to you and you were having a very nice and easy conversation. And all of a sudden you could notice that the person started drilling saliva.
In other words, that part of his mouth is not responding
yes,
to command.
Yes. On one side of the face, that's the F part. Then the other thing is harm. I talked about that earlier. Somebody was just holding a key or somebody was just holding a phone and all of a sudden it drops. And the person tries to use that hand and all of a sudden the person cannot use that limb anymore. Yes. And another thing is, the speech. Beyond the face turning towards one side or the person drilling. You could just see that
the speech pattern.
All of a sudden, what
happens
slurring
his
words, it
so.
becomes slurred and all of that. If you see any, and I emphasize any of those things I talked about, it is possible that that person has just had a stroke. Of course, in the line of harm could be the leg. That's the example I gave earlier, that somebody's just walking to the restroom and all of a sudden the person just drops. And the person is trying to get up and somehow the person just could not use that side of the face. Other things would happen. Somebody can tell you that, I'm looking at you right now, you can see me, I can see, all of a sudden the person just blackens out. I can't see you anymore. I know you're there, but I can't see you. I could hear you just a couple of minutes ago, and all of a sudden, I can't hear you anymore. All of those things can be signs of stroke. And a lot of times when these things happen, people will yes, we know we are very prayerful people in Nigeria. They start raining prayers. So people will bring all sorts of concoctions. And that takes me to what we call golden hour in medical practice. So when we say golden hour, what are we talking about? We're saying the first 1 hour when an emergency has happened. What you do within that first 1 hour can make or mar the person. So I just gave you an instance of somebody who has had a stroke. And somebody somewhere would say, oh, no, and don't take any injection, no. They might actually recognize that it's a stroke. So there's this popular thing Yorubas say. There is something called Rokpa Rose, and there's something called Romolakpa Romolese. That's the way they say it.
kind of
So,
massage.
Yes. So no, it's not the massage. I will explain it.
Okay.
So when you say romolakpa, romolese, you're talking about polio. Polio is a condition that causes paralysis.
Okay.
Do you understand? Of the upper limb and the lower limbs, the arms and the legs, as the case may be. That is romolakpa, romolese. But stroke is rokpa rose, i.e., there is weakness of the upper limb and lower limb. So really, in the Yoruba parlance, the one they don't take injections for is the polio. But it's not as if they don't take at all. But yes, that is what they believe. So
Kind of like general
they now
belief.
look at the romolakpa, romolese in the same vein as the rokpa rose. So somebody has a stroke. They've identified that this person has a stroke. But they will say, no, come back, Baberesi. Like, don't take any injection. And they take the person home. They don't bring the person to the hospital. And we say something, time is brain. The earlier you bring a patient with a stroke, because what has happened in the brain, so stroke can come in two ways. You could have a situation where there is, sudden or abrupt, shortage of blood supply to the brain. Because that is ischemic stroke. And you could have another one where a blood vessel can burst and the person bleeds into the brain. That's hemorrhagic stroke. But both of them, time is very important. Because remember...
Because they can be fatal.
Exactly. The brain needs blood. The brain needs oxygen.
At all times.
If this thing just happened, if this stroke just happens and you keep the person at home, you would have ended up allowing that part of the brain to go off like dead completely because you did not bring the person to the hospital. I am not making doctors out of us. I'm only saying when we identify these things, let us go to the hospital ASAP. Some people could, say, when I rest, it will go. We actually have a situation where, people call it transient ischemic attack. So what do I mean by that? All these things I just listed as the symptoms of stroke can go off within 30 minutes. But please, even if that's the case, where, somebody, had the slurred speech and everything, and all of a sudden everything just went back to normal, that is a warning stroke. You treat that as a frank stroke as well. So you take that person to the hospital ASAP, because the next one that would happen, the person may not survive it. So very, very important. Within that first 1 hour, we should be able to, transport the person to the nearest hospital. That is not the time to give any medication. That is not the time to do herbal concoctions. As you're taking the person to the hospital, go along, do your prayers as the person is going. I don't have any problem with that, but move that person to the hospital as soon as possible. So that's one very common emergency that can happen at home. And, when I started, I said fast, F-A-S-T. So I talked about face, harm, speech. Then the T is time. Time is brain. The earlier you get this person to the hospital, the better. So that is, for stroke. Another common emergency that we can have is what, we typically would call a heart attack. So how do you know that somebody has had a heart attack? And like I said, all these things can happen just as you're having a chat, you're having a cup of tea, and anything can happen at any time. So really nobody prepares for it. So what are some of those things that you can recognize or you would see, if somebody has a heart attack? So this person, just suddenly comes to you or complains about this gnawing chest pain. The chest pain is, squeezing, crushing. That's another word we use. And this continues, it can continue for the next 15, 20 minutes. Then beyond that, the person could say, the pain goes to my neck, it goes to my left shoulder, it goes to my back. And this person can also, start sweating, start, becoming breathless and all of those things. Once we see this, and we see a lot of these things happen in American movies, right? Once it happens, they call the emergency number, and they could say, do you have an aspirin there? If you have aspirin there, tell him to take, some 300 milligrams of aspirin, chew it, but get this person to the hospital ASAP. Just as time is brain, time is heart as well. When you have this heart attack, which can be caused by a lot of things, it could be that, the blood supply, to the heart just abruptly goes...
Cut off.
Yes, blocked. If you don't get that person to the hospital and we do something to quickly allow blood to flow back, that person might just go off like that, and that might be the end of that person. So these are common emergencies that can happen in our homes, in our spaces. We might even be around, our friends. And very importantly, for these two conditions, somebody who, has a stroke can have something going on in the heart as well. But very importantly, when you have this thing happen and maybe the person now drops, and that takes me to the next thing. This is a skill that all of us must know how to do. Even in saner climes, we've seen movies where dogs perform what we call CPR on people. A lot of people have slumped in awkward places. I mean, at medical emergency in Lasut, we see quite a number of emergencies. We've had, people rush somebody who slumped, from Arena, from under Bridge Ikeja. But at that point, the people there did not know what to do. There was one, they were pouring water on him. They put salt in his mouth.
Wow.
They did all they needed
Instead
to do
of
was
a
just to
simple
compress the
CPR.
chest. Just the landmark is not difficult. In between the breast, the nipples, that center in between the nipple, yes, that center, just that lower part. Put the flat of your palm there, and use the second hand to support it and start compressing. Whilst you're doing that, tell somebody to call the emergency number, and that's another thing a lot of people don't know.
Do we have emergency
The Lagos
numbers in
State
Nigeria?
emergency we have Lagos State emergency number 112 or 767.
112
or 767. Those are the emergency numbers for Lagos State, not 911. Of course, because they sang with 911, everybody seems to know 911. We use 112 or 767. Whilst you're there and you're doing your compression, somebody is making the call.
Do we have emergency responders?
Oh, yes, we do. Lassam Boss. And they are quite prompt. They are in strategic places here in Lagos. Just call these numbers, tell them your location. They will meet you there. There are paramedics on the bus that can start something whilst, they are transporting the person to the hospital. But you, the bystanders, can start CPR for this person.
Save the life of that person.
Yes, because at that point, the heart is not pumping anymore. So what your compression is doing is to mechanically, like we say, you are now pumping the heart from outside. Let me use that in a simple way. Yes, to compress the heart. And continue that till help comes. Call people to join you. You don't necessarily need to be a medical person. We go in 30s. We say 30 to 2.
Now, in Sena climbs, they teach the public how to do this.
Yes, how to do it.
It's time the
sincerely, we need to get
do
the conversation. Yes, we need to get the conversation out there. Let's start something. 30 compression. As you're doing, the next person that is assisting you is behind you. Just tell them, join me, do it. Just look at what I'm doing, do what I'm doing. It is as simple as that. And you would realize that if people drop within the first 5 minutes, if you're able to do a CPR for that person, you have increased their chances of surviving. You have reduced the complications that this person is likely to have.
In the operation table.
Yes, because remember, the heart is the pumping machine of the body. If blood is not flowing, all the vital organs need blood. The brain needs blood. The heart needs blood.
And they all go
the
through the
kidneys
hearts.
need blood. Yes, everything passes through the heart. That's the pumping machine. So once the pumping machine stops, if you don't get the pumping machine back on track, you would have all the other organs shut down. So very importantly, all these things, we should be able to identify it. Another common thing that happens is that
before we continue, let's go back to how to do that CPR. So for those watching us on YouTube, they can see it, but for those that are listening to us on radio, they need to have a mental picture. Of how to do that.
So you expose the person's chest.
Okay.
You know the nipple. We know where the nipples are, right? At that the middle part. So if you put wherever you are now, if you put run your finger through the middle part of your chest and run it down. You
the
get
lower part of it.
Yes, to the lower part of that hard structure.
Close to where the nipples are.
Yes,
in the middle.
Between.
Yeah.
You're not pressing. So once you get to a soft spot, you're already around the stomach. We are not getting there. No. That middle part, if you run your hand now, you feel that hard structure go all the way down.
Is it around the chest cavity?
Yeah, so the chest cavity is big. It's on both sides.
Okay.
So I'm trying not to use medical terms. Just that center. Trace that center down to the lower part of that hard structure in the center. Put the base of your hand there. Okay. And support it with the second one
of your
and
palm.
Start compressing.
Okay.
And very importantly, when you're compressing, since some people are watching us, I don't know if I stand, maybe they will see me. Sorry. So you're standing, you're locking so when you're compressing, you're locking your elbows. You're keeping it straight, because what is compressing that chest is the weight of your body, not the elbows, but the weight of your body. So you're going over, like you're rocking over the person's chest.
Okay.
Because you need all that force to compress that chest.
Okay.
Just start something. As you're counting, once you get to 20, 20, 21, 22, tell the person, next person, please get ready. 20, 22, 23, 24, 25, 26, 30. Another person takes over. Because the truth is, if you do your CPR the way you should do it, it is exerting.
It is.
You will sweat, but you will help that patient.
Okay.
Do you understand? All right.
Okay.
So Yeah. I mean, I've mentioned two very common emergencies that we typically see: stroke and cardiac arrest. Another one, very common one that happens a lot of times, it happens in maybe marketplaces, is somebody convulsing.
Okay.
So you see somebody who is convulsing. At that point in time, everybody is taken to their feet. Oh, don't let his saliva touch you. There's nothing like that.
We attribute everything to
I'm
spirituality in
telling you, the
Nigeria.
saliva is not infectious in any way. All you need to do for this person is to move close to this person, turn him on his side like a baby would, lie on the side, and support him while he's jerking. Support his head so he doesn't hit his head on hard objects. He could have head injuries from there, could go unconscious. Just support that head, from hitting the wall.
Turn him sideways.
Sideways, just on the side.
Okay.
Support
Then
him there
support
because
the head
it's
from
convulsing.
touching the ground.
Yes, don't allow his head touch the ground. If you have something soft, you could use that something soft
Like a
just to
pillow or
pad.
something,
Yes, just
yeah.
to pad his head and allow the seizures settle by itself.
Okay.
Immediately after the seizures, move the person to the nearest hospital. Some people would say, put spoon in his mouth, put your fingers. If you try to put your finger in that mouth, he's going
To
to chop
bite
it
it
off
off.
completely.
Wow.
Don't put spoons, don't put sticks, don't put anything in the mouth. Just keep the person to the side. And the reason why you're keeping the person to the side is because you don't want the tongue to fall back.
Oh.
So if the tongue falls
Fall
back
back.
into the airway, the person can't go from there.
Because
That
it will
airway is
disrupt
very
the-
important.
the
It would
flow.
obstruct the flow of hair, yes. So just keep the person on the side, allow hair pass, allow the seizure to take its course, and move the person to the hospital as soon as possible. So these are common things we see in our environment, and we need to, increase the conversation in all the spaces. You go to
do.
church, you go to the mosque, you are in small gatherings. We've seen cases where people are just at the cafeteria and they throw a fit, and everybody just goes AWire. Everybody leaves them. Or some people have had stroke even whilst eating at the restaurant, or somebody has had a cardiac arrest. These are things that we typically see, and we have told us some of the things that we can do for this person. At no point in any of these emergencies should you try to put something into the person's mouth. Because if you do, remember at this point, this person cannot control the airway. This person cannot control the way they swallow. So what will typically happen is when you put something in their mouth at this point, it will go into their lungs, and they will battle with chest infection for a very, very long time. So the don'ts are, don't panic. Don't put anything in this person's mouth. I mean, don't introduce any object whatsoever. Move this person to the nearest hospital, like nearest, as soon as possible, and you call the emergency numbers, 112 or 767. For those of us who use this line that uses 737, just remember the 346, 767, 11. After 21 is 2, 112. That way it's easy for you, to recall when you are in situations where, where you have such emergencies. But remember, as I said earlier, the golden hour, the first 1 hour after an emergency,
It's very
determines
crucial, very
what
critical.
happens to that patient. Because if somebody, for instance, has had a stroke and you're bringing the person the next day or the day after, I mean, some people would have taken the person to a religious house, they would have prayed for days, and they realize that this person is this person's condition is getting worse. You don't know whether at that point in time the person is already bleeding into the brain, where we need to do something really very fast. If we don't do that, the person continues to bleed into the brain, so the person just passes on from there. So all of these things are very important. Let us recognize these emergencies. Let us move the patients or the clients or whoever the person is to the hospital as soon as possible, regardless of who you are. Even as a bystander, you can help somebody. But if you don't know what to do, just call these emergency numbers, please.
112.
Like I told you, yes, 112 or 767. The guy who had, who slumped on that bridge, Ikeja, and they were there pouring water
and
pouring
salt.
salt. By the time he got to the hospital, he was already, way gone. So these are, common things we see in our spaces, and these are, some of the responses that we should have, in such situation. I don't know if there are other areas you would want me to emphasize
now,
on now.
there's this thing I say. I mean, the word came from a movie, but it has become a tandem to what happens in Nigeria, where they say God cannot do for man what man can do for himself. But we're in a climb where we attribute everything to one old woman in the village. We're in a climb where we take everything to church or mosque for something you can do.
Yeah.
The same God that gave us spirituality is the
Yes.
same God that gave us brain, because God cannot do everything.
Exactly.
He gave us the wisdom to do these things. And that's why it's good to have people like you, give us this information so we should know some of these things, to do.
Yeah.
Like the CPR. This is where the National Orientation Agency comes
Yes.
into play. And we keep asking, what are they doing? Go to communities,
Yes.
go to churches, in different language
Roadside,
and roadside
bystanders.
markets. Teach people how
Knowledge
to
has to be
perform.
commonplace.
Yes, teach these people how to do this common practice like the CPR
Yeah.
to save people's
Lives,
life.
yeah.
Again, Dr. Odunaye Badmos Sekinat, thank you very much. This has been really, really informative. Thank you very much. We hope to, see
No
you
problem.
every time to get, in VOP, we educate, we inform, we entertain. So she's a consultant family physician and one of the coordinating consultant at the medical emergency. Last with that, Lagos State University Teaching Hospital, Ikeja. Again, join emergencies. What number to call?
112 or 767. That's the Lagos State
112
emergency number.
or 767. I mean, even our movies, I'll urge movie practitioners to. We keep hearing 911 because that's what we see. We've consumed a lot of American. It is time we get Nigerian movies
Yes.
to educate Nigerians
Yes.
on this 112 or 767 emergency numbers. Again, thank you very much, Dr. Odunaye Badmos Sekinat.
You're
Thank you very
welcome.
much
It's
for
my
coming to
pleasure.
VOP.
It's my pleasure.